Today on Conversations with VIE, Brian Coburn and I will be discussing how new technologies in physician preference items are increasing costs, while obviously not increasing the reimbursement. So we'll go right into it. Brian, obviously we're seeing a lot of new technologies in physician preference items, mainly spine and orthopedic procedures. Can you give me some recent trends that you've seen?
Some of the recent trends we've seen, especially in orthopedics, are introducing new materials for the same components. So in the case of total knee replacement, you'll see the traditional plastic liner being replaced with one treated with vitamin E, and you can see an extra $1,000 cost per case just for that piece of new technology, that new material.
What about as far as some of the components? Are there different types of material for the components?
Yeah, absolutely. Especially when you're talking about total hip. Everybody's seen the introduction of ceramic hip heads, which can greatly increase the cost, and also in hip liners, new material with improved, new material to stimulate bone growth or for additional mobility, especially in the hip cup, can greatly increase the cost per case.
Let's switch over to spine. What are you seeing as far as the spine orthopedics?
Absolutely. So in spine orthopedics, we're seeing a lot of the same thing we're seeing in total joints, which is new materials. You'll see the traditional interbody fusion devices that were made out of PEEK being blended with chrome or blended with titanium, and that new material costs substantially more than the traditional plastic alone. Also, what we see a lot of in spine is changes in approach causing huge increases in component costs. So for lumbar pedicle screws, multi-angle screws or extreme angle screws, surgeries that come from a lateral approach costing significantly more than traditional approaches.
Right, and what we've seen, because when we always do our spine analysis and work with our different clients, and maybe talk a little bit into this, but we always pull in reimbursement. We understand where the cost per case is, and then also what is the reimbursement. Do you want to go into that a little?
Absolutely. So when we're looking at Medicare reimbursement, it's a fixed reimbursement. So if you're doing a lumbar fusion, you get a specific rate back from Medicare. And it doesn't necessarily matter which implants you're using. If you're utilizing new technology, we're seeing some new technology that greatly increases the cost, for example, of a pedicle screw, fenestrated screws starting to be used, which actually allows for injection of bone growth material to a specific site at a significantly higher cost than a traditional pedicle screw, or again, the case of the extreme angle screw. A lot of these components are brought in if there's a contract in place. They bypass the established rate of a pedicle screw because the vendor and the physician feel that they're differentiated from that.
Right, and not only from a reimbursement from Medicare, but also the managed care. It's either percentage of the charges, or sometimes it's a per diem, and you're not really recouping the costs of the case.
Absolutely. So it's important that when new technology is introduced, that it's done at the same rate as the existing components that are used. It's not fair that the hospital should have to take on the cost of the implants while the vendor gets the increased revenue for that technology.
If your hospital is interested in evaluating the new technology costs and how that affects your reimbursement, give us a call. We would love to have a conversation with you.